This week, the Trump administration announced that it would be taking bold action to address what it described as an epidemic of autism spectrum disorder. Health and Human Services Secretary Robert F. Kennedy Jr. has long insisted, often while citing weak or discredited research, that an outside influence like a toxin or a vaccine must be responsible for this rise in diagnoses. He is correct that autism spectrum disorder is diagnosed far more often than it used to be. In 2000, when the CDC first started collecting data, 1 in every 150 American 8-year-olds was identified as autistic. Today, that number is 1 in every 31 kids. But researchers say that to understand these numbers, you have to consider two essential facts. The diagnostic definition of autism has changed drastically over the decades, and we look for it a lot more often than we used to. The American Academy of Pediatrics only started recommending universal autism screening in 2007. Before that, even a lot of pediatricians weren't familiar with its earliest signs. Today, doctors, psychologists, and educators are more proactive in identifying autistic traits in children and recommending kids for further evaluation when it's necessary. Also, the definition of autism has changed dramatically over the decades. When autism first showed up in psychiatry's diagnostic Bible about 50 years ago, kids had to meet a very strict set of criteria to be considered autistic. They had to show impaired communication, unusual responses to their environment, and a lack of interest in other people, all before the age of 2.5. Today, the diagnostic definition of autism spectrum disorder is much more expansive. It includes a diverse range of behaviors, communication patterns, and social differences, and it can be diagnosed at any point in a person's life. As one researcher told me, people haven't changed that much, but how we talk about them and how we categorize them has changed a lot.